Guns and public health. Applying preventative medicine to a national epidemic. Let's see what this is all about. So here's what the article says from CBS News. It happened again twice in less than 24 hours. Are any of us surprised? No. Can anybody help? Yes, people can, but chances are no one's really going to, at least not at the mass level. When a panel of 7 doctors was asked how many had seen a gunshot victim within the past week, 3 hands went up. I think people think that if their loved one gets to a hospital, that there's magic there, but sometimes it's just too much for us. If there was ever a time for preventative medicine, it's now, says a group of doctors. So Dr. Roger Mitchell says a grandfather was shot yesterday, a son was shot yesterday, a mother was shot yesterday. And the day before that, there were 5 people that were shot that were connected to Americans in this country. They've had enough and seen enough. The only thing worse than a death, says Dr. Ronnie Stewart, is a death that can be prevented. So Dr. Stewart, Boone, and Mitchell, along with Drs. Albert Oshbar, Neva Lubin-Johnson, Chris Barsotti, and Megan Ramney, were in Chicago this past winter as more than 40 medical organizations who normally operate separately joined forces to address the 40,000 firearm-related deaths that occur each year. Their meeting followed a tweet from the NRA. Now I remember that tweet where doctors were speaking out about shootings, and someone said, the NRA said, someone should tell self-important anti-gun doctors to stay in their lane. And Dr. Bone, a trauma surgeon in New Jersey, snapped a picture of a waiting room and said this: "Hey, NRA, want to see my lane? Here's the chair I sit in when I tell parents their kids are dead. How dare you tell me I can't research evidence-based solutions?" Thank you, Dr. Bone. And I'm probably mispronouncing your name, and I apologize for that. So then a bunch of medical professionals responded with hashtag "This is our lane." Our motto is do no harm for physicians, but I think the community felt that harm was being done to us by that tweet. Okay. So what they're trying to do is they're trying to focus on preventative care to try to prevent stuff like this from happening, to try to kind of nip this sort of stuff in the bud. I guess they missed the message that it's just Colin Kaepernick and the gays. They must have the doctors missed that message. They're thinking we can focus on preventative care, that's something they can do. Didn't they hear Candace over in Ohio? It's the gays and Kaepernick and Obama. It's them. That's the problem. So let's see if there's anything else to this article before we move on. So they're calling for more preventative care, and they're also calling for gun policy. And they're saying, look, this is our lane too. So what they're saying is doctors are not experts. This is Dr. Winnemute who says this. Doctors are not an expert on gun policy unless they do their homework. What doctors are experts on is the consequences of violence. If doctors choose to be, they can become experts on policy. And this is about stopping shooters before they shoot. So focus more on preventative care. I get that. But you know what? One thing I will say in response to this, we have this illusion that somehow people sitting in office are these policy experts all of a sudden just because they're sitting in office and they get a vote. I can only speak from my personal experience. In the past 2.5 years of my life, because I've worked on the Jimmy Dore Show, I've been around the political arena, and not just because of the Jimmy Dore Show, because of other shows too. I used to be a regular on the Stephanie Miller Show. I got kicked off. I've been around more people in the political arena than I ever have been in my life. As a result, I am more cynical towards the process than I ever have been. I am more radical than I ever have been. I have less confidence in electoral politics than I ever have in my life. Whenever I meet people in the political arena, I think less of them after. That is 90% of the time. 10% of the time, I feel like this is a diamond in the rough. 90% of the time, I used to say 70% of the time, I realized that was being too generous. People in the political, there's not some special badge that they have, some type of expert badge that they're wearing. A lot of times they just talk nice, and a lot of times they're susceptible to corruption. Because to really play the political game, it is the most corrupt thing I've ever seen in my life, and I'm in show business. And again, I am speaking from one person's experience, but in my experience, show business on its worst day has more integrity than the political arena. I mean, I had a joke about it in my act where it's like sometimes people ask me if I'm going to run for office ever. And I say, no, I'd rather stay in an industry that has a little more integrity like show business. That's not an embellishment. That's the truth. So this idea that doctors aren't qualified to talk about policy. Doctors, I'm telling you, don't sell yourself short. My message to that doctors, it's awesome you're focused on preventative care. That's great. That's something you can do that can certainly help this. Of course, health is part of the conversation. It's not the only conversation. When people just say, oh, it's a mental health issue. No, it's an all the above issue. And gun policy is part of that all the above. So don't try to make it out like it's just, is our lack of healthcare in this country part of the conversation? Abso-frickin-lutely. Is mental health part of the conversation? Abso-frickin-lutely. But is gun policy part of the conversation too? Yes, absolutely. So don't try to make it out like it's one or the other, or that guns aren't the problem. They are too. But anyway, it's awesome that doctors are focusing on this. But don't try to make it out like, oh, we're not policy experts. We're just, yeah, you're doctors. You save lives. You're medical professionals. Some politicians, not some expert on policy that you're not. You know how much I like the idea of doctors in government is that the last presidential election, I voted for one. I voted for the Harvard-educated doctor. I sometimes think about that. If you just described, like if all the fluff and the media and all the hype was just like completely not there, and you just described all of the nominees to like somebody, and then they just went in and voted, Jill Stein would have won by like a landslide. You know what I mean? Like, because it would have been like, okay, so this person's a TV host who is a reality TV star, has a history of saying very questionable things, has a racist history, and is basically just a big plutocrat. This other person is maybe the most corrupt politician ever in our times. Definitely the most corrupt of the Democratic Party. It was very. The primary was absolutely gross. This other person, Harvard-educated doctor. And then this other guy believes that we can run healthcare like an Uber app. Anyway. So I guess my point is, doctors, you could talk about policy too. You know, just because someone's in office, they don't have some policy expert badge. All right. That doesn't exist. It really doesn't. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your